Hi everyone, Amber Canoy here for Everyday Kentucky. Ladies, listen up. We're talking about weight gain. We are visiting Solutions Functional Medicine today with Mandi Snell, and wow, women, they just have it, I feel like coming to them when they hit that perimenopause age. I myself am in it. All of a sudden you're gaining weight, you're doing all the things, trying to be healthy that you've always done before to lose weight, and nothing seems to be working. It just sneaks up on you. So
well, that's every woman's story. It's everyone's story. We hear it every week after week. Women can be so frustrated. This is a very conscientious group of women. They are doing the things right. They're paying attention to what they eat. They're moving their body, maybe even exercising regularly, and caring about their food intake and being conscientious of that. And in spite of all these things that have worked before, now they don't seem to have the outcomes that are predictable any longer, and that's very frustrating. And much of this is due to the changes associated with menopause and perimenopause. And of course, perimenopause, as we know, can start as early as 10 years before menopause. And these are due to fluctuations in estrogen and progesterone and other hormones that control your metabolism and the way that your body stores fat. And this is very distressful for women, along with other symptoms associated with joint pain, insomnia, night sweats, mood swings. But this is debilitating to women, not only in the aesthetic sense, but it can hurt their well-being, their sense of well-being, and their health.
Yeah, just their enjoyment of life. If all of a sudden they're carrying around extra weight, they can't lose it, and maybe the joint pain's impacting them being able to do things that would actually help combat some of the weight gain. It's like this vicious cycle where you just feel like you can't get ahead. So what can you do?
So women need to hear that there are solutions out there. There are hormonal and non-hormonal. But studies show very clearly that replacing the receptors in the body with the hormones that are predictably declining is very helpful, not only for vascular risk, but for the obesity associated, or increase for obesity associated with perimenopause and menopause. This is crucial for our health. And in spite of knowing that, hormone replacement therapy seems kind of risky for all the things I've heard in the last few decades, we know that that data has been highly questioned and even rescinded as legitimate data coming from the Women's Health Initiative in 2002. Women now need to hear what their real risk is in numbers for themselves, and to have that conversation. While hot flashes and joint pain and insomnia may not motivate women to ask the question and have the conversation, sometimes weight gain will finally prompt them to find out and have the conversation with a provider.
Well, how can they do that?
Well, they are welcome to reach out to us at Solutions. We have an inquiry consult, which is well named as time for women to come and ask questions to us. What can you do, and can you help me? And of course, when we discover that we can, we'll get some labs and we'll schedule them for what we call a solution session, which is a 90-minute commitment with one-on-one with one of our expert providers in hormone care, to give them a small endocrinology class one-on-one about their health with their resulted labs, and find out what we can do to get their metabolism well and to help get them in a place that is healthy and risk-free.
And we have not talked about this, but I'm going to go out on a limb here real quick.
Okay.
If they have, by chance, had labs done with their primary doctor, even if they come back and say they're normal, sometimes they're looking at what normal is very differently than functional medicine.
That's very true. A lot of times labs are a common range, and we are not interested in feeling common.
We want to excel. All right, we'll give them a call or go online.